Namaste, everyone, and welcome back to Public Health Pulse. Today's episode is dedicated to World AIDS Day. This year's theme is Overcoming Disruption, Transforming the AIDS Response. And in the next few minutes, we will unpack what that means globally and for our region. Stay with me till the end for simple actions you can take to support the HIV response. World AIDS Day is observed every year on 1st December. It started in 1988 as the first ever Global Health Day. The aim is to raise awareness about AIDS and HIV and remember people who have lost their lives to AIDS related illnesses and stand in solidarity with people living with HIV. It is also a reminder to governments and health systems that the HIV response cannot slow down. So, before we talk about solutions, let us quickly look at the numbers. Globally, around 40.8 million people are living with HIV. Every year, more than a million people acquire HIV for the first time, and hundreds of thousands still die from AIDS related causes, despite effective treatment being available. These numbers show that HIV is not over and the world cannot afford to be complacent. For viewers of Public Health Pulse, the Southeast Asia and Asia Pacific picture is especially important. Our region has millions of people living with HIV, with thousands of new infections reported every year, included among young people aged 15 to 24. At the same time, there has been a significant reduction in AIDS related death over the last decade, which shows that treatment and prevention programs are working when they are properly funded and implemented. World AIDS Day comes at a time of serious disruption. Globally, HIV funding is under pressure, which is affecting prevention services like PrEP, access, and youth focused programs. Community led services, which are essential for reaching key populations, are being scaled back in some places. And even today, more than 9 million people living with HIV are still not on treatment. If these gaps continue, progress towards ending AIDS by 2030 will slow down or even reverse. The good news is that the HIV is preventable. Some of the key prevention strategies are very practical. Using condoms correctly and consistently during sex greatly reduces the risk of transmission. Getting tested regularly and treating sexually transmitted infections help protect both you and your partner. Limiting the number of sexual partners and avoiding sharing needles or injection equipments is also crucial. For people at higher risk, prevention medicines like PrEP and emergency options like PEP after a potential exposure are powerful tool when used correctly under medical guidance. HIV treatment has transformed HIV from a fatal infection into a chronic manageable condition. The global target is called 95 by 95 by 95. This means 95% of the people living with HIV should know their HIV status. 95% of those who know their status should be on antiretroviral drug or therapy, and 95% of those on treatment should achieve the viral suppression. When viral load is suppressed to undetectable levels, people stay healthy and the risk of transmitting HIV to others becomes extremely low. In the South Asia East region, there has been encouraging progress towards these targets. A large majority of people living with HIV know their status and many are on treatment and virally suppressed. However, the region is still short of the 95 by 95 by 95 goal. That means there are still people who have not been yet diagnosed, and people who are not linked to care, and people who are lost to the follow up. Strengthening the primary healthcare community outreach, and stigma free services is essential to close these gaps. One of the biggest barriers in the HIV response is not the virus itself, but the stigma and the misinformation. HIV today is a manageable condition with the right treatment, and people living with HIV can lead long, healthy, and productive lives. The concept of undetectable equals untransmittable, or U equals U, remind us that when someone's viral load is undetectable, they do not transmit HIV sexually. Instead of fear and discrimination, people living with HIV need dignity, respect, and supportive health and social systems. So, what can you, as a viewer of Public Health Pulse, actually do? First, know your status. Get tested if you have never been tested, or if you have had new risk exposures. Second, support prevention efforts by promoting safe sex, regular testing, and harm reduction in your circles. Third, speak up against the stigma whenever you hear myths, jokes, or discrimination related to HIV. And finally, support policies and programs that invest in community led, rights based HIV services. So, on this World AIDS Day, remember that ending AIDS is not only a medical challenge, it is a public health and a social justice challenge. At Public Health Pulse, the goal is to break down the complex health topics into simple, actionable insights for you. If you found this video useful, do like, share, and subscribe to Public Health Pulse, and share this with someone who needs to hear it today. Together, we can overcome disruption and transform the AIDS response. Thank you for watching, and see you in the next episode.